Good day, everyone. I'm Kevin Gletz, and I am a program facilitator working with the Regina District Industry Education Council in Sun West School Division. Today, it's my pleasure to introduce Teri-Lynn Hayes, who is a public health nurse with the SHA. When many people think of nursing, they think of RNs or LPNs, but Teri-Lynn is here today to shed some light on this other aspect of nursing and let us know what public health nursing is all about. Just a reminder, before we begin, this session is being recorded and will appear on the RDIEC YouTube channel for you or others to view in the future. Just go to the RDIEC website at www.rdiec.ca to find the YouTube channel. Thanks for taking time to do this session today, Teri-Lynn, and I'll turn it over to you.
Hello, everyone. I'm Teri-Lynn Hayes. I'm a public health nurse at Rosetown Community Services. The communities I serve in my role are Elrose and Kyle. And I am in a 60% position. So I work Tuesdays, Wednesdays, and Thursdays, and then I help out if people need fill in, then I do work a little bit more, but my actual role is just a 60% position. So public health nurse, what is it? Public health nursing is basically shaped around health promotion and disease prevention. That's kind of where we work from. That's the theme of our work. In the description of my job, these are kind of more of like the tasks that you would do in a day. So in my typical day, I may do a postnatal home visit. So a postnatal home visit, we receive a referral from whatever hospital baby was delivered at, telling us about the delivery and how baby did in hospital. And then we kind of take it from there. So we would call mom and dad or mom, whoever we end up talking to, make that first point of contact and set up a visit that we come into their home to check in on mom and baby. So at the actual home visit, we would do a weight check in with feeding. We would do a physical assessment of the baby to make sure everything is fine there. We would set up the first immunization appointment for baby at 2 months old. And then we would also check in with mom. So mom, how's her physical and mental health? And that visit really is just kind of our first point of contact to start setting up that relationship with the family. We let them know that we are a resource and we hope they reach out to us. And kind of that's kind of our first point of contact to set up that relationship with the family. And that kind of leads me into child health clinics. So child health clinics are also known as baby clinic. And in Elrose and Kyle, they occur once a month. So the routine immunization schedule for Saskatchewan is 2 months, 4 months, 6 months, 12 months, 18 months, and 4 years old. And then you would be dealt with in the school for immunization. So there is an appointment for each one of those ages. And so we set up an appointment that you come to the clinic. And then we obviously start with addressing any concerns that the family might have. So I always start every encounter with family. What are your concerns? Just because I feel like you got to start where they're at. And if you start and they have concerns in the back of their head, they often don't absorb what the other things you're trying to talk to them about. So we address those concerns right off the hop. And then we would check in with baby's growth and development. We obviously administer immunizations at that clinic. And then all the vaccines are recorded on a computer program that is province-wide, and it's called Panorama. So they have an electronic record of all the immunizations that they've received. And from that appointment, we can refer on to several other places. So referrals may be to the dental therapist, lactation consultant, dietitian. We can refer to speech language. We can refer them to their family doctor. If there's things that we feel need to be addressed, we can refer them on to several places. It's also a time to check in with mom, specifically regarding mental health. At 2 months appointment and 6 month appointment, we would do a postpartum depression screening with them. And then we have resources that we can refer on to for mom as well, if she's needing something. And then, yeah, that leads into routine school immunization. So there's routine school immunizations in grade 6 and grade 8. We also check in and check in everybody's immunization status in grade 1 as well. So the school division's database feeds into our Panorama program. So I can just type in Elrose School and do a search of the grade 1s, and it'll bring up all of grade 1s or grade 6s or whatever. And then I can look at their immunization status and get in touch with families of people who have fallen behind. But also in grade 6, then and grade 8, we would give those routine immunizations. So consents are sent out to families, they come back to us, and then we have a day where myself and another public health nurse would attend the school and administer those immunizations. Flu and COVID mass clinics. So that's a big part of our job at certain times of the year. Yeah, fall and spring usually. We lead these clinics, we organize them, we bring all the supplies, we take down all the supplies. Yeah, those are big days for us and busy times for sure. We also address communicable disease investigations in education. So if like a communicable disease investigation came across the desk of the ladies that there are people in Rosetown that actually deal specifically with communicable disease, they would send that on to me if it was in my area. So if it was in Elrose and Kyle, so if there's an STI, a hospitalized flu or COVID, any other communicable diseases, I would be getting in touch with those people, doing some investigation and as well as some patient education with them. We also do classroom presentations. So that's kind of on an as needed basis. There are certain teachers that like to have public health nurses in as guest speakers and others that don't. So we would cover topics like hand washing, maturation, sexual health, contraception, those types of things in classrooms. And we have kind of a variety. They're just actually in the process right now of creating a database that we can take those presentations from to make it more standardized across the province. We also do car seat safety clinics. So we are certified through SGI, and then yearly you have to be recertified. We would set up a clinic. They're usually held in the summer just due to the weather being more conducive to being outside and in vehicles and stuff. We check in on all types of car seats. Some people come before babies are born just to make sure it's installed properly in their car. We check the fit of the seat to the child as well as the fit of the seat in the car. And then we would make recommendations to families if there's things that have come up that need to be rectified and go from there. So those are kind of like the main tasks of my job. Skills. So I just kind of wrote out kind of a few like points, the skills. So obviously all nursing, caring, empathetic, you need to be a leader. You have to have great assessment skills. You need to be organized, self-motivated, efficient. And then there's some special knowledge you have to have, obviously of vaccine administration and the storage of, and handling of vaccines, but other specific things that I can think of that we have to take extra training for would be breastfeeding, obviously, anaphylaxis. So there is always a risk when you give an immunization that there could be an anaphylactic reaction to the vaccine. So we are trained in that, and we carry epinephrine with us anytime we're administering vaccines. But those are kind of the list. And then when I think about the skills you need, you're obviously working with people at very vulnerable times in their lives after a baby is born. Those first 18 months, you do see them quite frequently, and they really do put some trust in you to impart them with the knowledge that you have. And you're also, needles can be like a really anxious time. So you're working lots of times with highly anxious people, and you need to be a calming presence. You do work alone a great deal of the time. So you have to be self-motivated and kind of create your own work plans to meet those timelines that things need to happen. You're a leader at vaccination clinics, and you need to be knowledgeable because you're the point of reference when you're in that mass vaccination. If you are the leader of the vaccination clinic, they are coming to you with the questions that kind of fall outside the routine things. And you need to vaccinate a lot of people in a short period of time. So you have to be efficient as well. My biggest skill, I think, that I've learned along the way, I've been a public health nurse for 6 years now, is you just need to meet people where they're at, try to understand where they're coming from, and provide them the support they need in that moment. I like to, yeah, like I said, start every appointment asking where the concerns are at, and we can work from there. A large amount of travel in rural public health nursing. I traveled over 11,000 kilometers last year for work. Our region is very large and it requires a lot of time on the road. So that's in rural public health nursing, there is a lot of travel time. So location and setting of my work. I have an office at Rosetown Community Services. That's where I would work on my office days. My child health clinics are located in the Elrose Health Center as well as the Kyle Health Center. I'm often in clients' homes. Community halls would be for those mass immunization clinics. I'm in schools. I wouldn't say frequently, but certain times of the year, I'm in schools a lot. We like to do a presentation to the kids when we hand out those consent forms. So just discussing what vaccines they're going to get and the diseases that we're trying to prevent. So there's that. I also work in parking lots doing car seat safety clinics. So those would kind of be the main locations of my work. These are just a few pictures to kind of give you an idea of different scenarios you could find yourself in as a public health nurse. Yeah, on the top right would be what a child health clinic room would look like. And then, yeah, an example of a home visit below that. Below that would be kind of like a mass immunization clinic setting. Yeah, and then across, obviously checking a car seat, and yeah, just some other pictures of immunization. And these photos are kind of from my personal collection. I don't have a lot of photos of what I do at work, but I did take some pictures during COVID, obviously, when we started off with the COVID vaccination program, because it was a big, exciting time in our lives and careers. So that's just some pictures of when we were doing our COVID clinics. And then, yeah, a little note that I got from a girl. Thank you for all your hard work. I wish that everyone would get the vaccine so we could live a normal life again. That was a really nice note that I got during that time because we were working really hard and it made it actually all seem worthwhile. Rewards of the occupation. Obviously working with clients and families. So like I said, a very vulnerable points and times, usually in clients' families, that you get to work with them and you get to be that support. And for me, it's nice. I get to mix, as a nurse, you always want to have that evidence-based best practice, but I also get to mix in a little bit of my life experience. I am a mom of 5, so it's nice to kind of sprinkle that in. And it also helps me have empathy for those new moms in those situations where they are feeling really vulnerable. Also like to provide support and referrals along the way, and that's just a really nice when you can help people problem solve some situations that they're in. And you are often, yeah, that go-to person for people, and it is nice to help people out when they are feeling stressed, and you can kind of help them work through some things and give them some knowledge that helps them decrease their anxiety. Another reward is obviously I work in communities that I care about, and you are doing health promotion and disease prevention. So vaccines work. Over the past 50 years, vaccinations have saved more lives in Canada than any other medical intervention, and you get to be part of that, and that's awesome. Also, obviously injury prevention. So we speak with parents lots about safety at each one of the child health clinics. And then obviously car seat clinics is another way we can help prevent injuries in our communities. So I find that really rewarding. Challenges. Well, you're known as the needle lady. I've walked into public places like rinks and had kids run away screaming from me. So you have to get used to that for sure. Um, I obviously consider every encounter we have a success if we end up immunizing a child. So there's not much I haven't seen, but you do have to um, have a lot of patience and empathy for people. And so you need to check yourself before you start your day for sure. So yeah, you have to be comfortable being known as the needle lady. Not a lot of adrenaline rush situations. So in nursing, there's some people who love those adrenaline rush, like emergency room type situations. This would not be one of those occupations. Pretty nice pace. Yeah, which I think is also a reward because you do get to feel like you have enough time to spend with people and really address any questions they have. Another challenge would be obviously the anti-vaccination movement has been made our jobs tougher and we end up in some challenging situations for sure. And again, you just have to try to meet people where they're at, but it is obviously there's a lot of misinformation on the internet. Vaccination has become such a polarizing topic in certain realms. And there is just a lot more mistrust in the government than there ever has been. And I guess another challenge, if you're the type of person that wants to move up the career ladder, public health nursing, once you're a public health nurse, you're kind of a public health nurse, unless you want to, become a manager, I guess, of public health nurses. You're kind of, that's where you're at. So those would be the challenges. So salary and benefits. So as a public health nurse, you are considered to have a special realm of knowledge. So a nurse A would be like a general duty nurse working on the floor in acute care setting or long-term care, wherever. We are considered nurse B. So you're one pay scale above that, I guess. So the range is $42 to $52 per hour. There is a great benefits package through Great West Life. So you would get like dental, drugs, massage, chiropractor, acupuncture, naturopathic doctor, mental health counseling, lots of different things through your benefit package. And then you pay into the Saskatchewan Healthcare Employee Pension Plan called SHEP. So that just automatically comes off your check so that you get a pension when you retire. You get 3 to 8 weeks paid vacation, just depending on your number of years of service. And as a public health nurse, generally speaking, your hours of work would be 8 to 5, Monday to Friday. Other than during flu season, we do try to provide extended hours for those clinics. So the only time you work outside of those hours, but pretty much 8 to 5, Monday to Friday, which as a nurse is quite handy, especially if you have a family, that you're not doing the shift work thing. So educational requirements. So I copied this from the Regina U of R nursing program. So you need one ELA, either 20 or 30. And then you need one math from category A column. It can be a 20 or 30 and it excludes workplace math. You need one course from category A, any that you want to pick from at a 20 or 30 level. You need one course from category B, 20 or 30 level, and one course from category A, B, or C at a 20 or 30 level, which makes this nice because you can pick courses to help improve your average because it's obviously a competitive entrance. So they do give you quite a variety of courses that you can pick from. So you can pick your best classes kind of to put towards your average. So my journey, I graduated in 1996. I went to Saskatoon Business College after that, and I got my accounting diploma. In 1997, I worked for a couple of years and realized that I needed to do something that I felt like I was directly helping others. So I kind of started looking around. Right then, there was a lot of hype in the media just about the upcoming nursing shortage. And so I thought, well, nursing sounds great. You're definitely going to directly help people. So I started the nursing education program of Saskatchewan through the U of S. It was 2 years at Sask Polytech and then 2 years at the university, just based on space available. But it was a degree program. I was accepted. It was called the Accelerated Fast Track. So I got, and that is still offered. I got my degree in 3 years. So I went to school year round. There's fast track. So accelerated fast track, I graduated in October. Just fast track, you graduated in December, and then just regular getting your 4-year degree, the regular May graduation or whatever. And then you write an exam to get your actual designation as a registered nurse. I worked in neonatal intensive care for 4 years when we lived in Saskatoon, and then we moved to rural. And I've had various roles in the Heartland Health region. I worked as a long-term care nurse. I managed a couple of long-term care facilities. I worked in quality improvement. I worked as an educator for long-term care, but I have been a public health nurse since 2018. So opportunities for public health nurse, and I do feel like it's changing just because the workforce is changing. But in my experience, becoming a public health nurse was more like a mid to late stage RN career because you needed seniority. Those were like the highly sought after jobs. I do really feel like that is changing just because, well, I don't know, the workforce has changed, I guess. Other opportunities that you could kind of go to if you more worked in maybe like more of an urban center would be communicable disease roles. You can work in sexual health clinics. You can work at a travel clinic. So public health nurses only provide publicly funded vaccines. So if you need vaccines that you have to pay for, you need to attend a travel clinic. So you could work in a travel clinic. You could become like the manager of primary healthcare is who our manager is. So that would be another opportunity within public health that you could investigate. Work-life balance. Public health and nursing, I think, provides a great work-life balance just because you are just working regular business hours. And you don't necessarily require a replacement if you need to take vacation. So there's that. Like, whereas if you're a floor nurse and you can't attend a shift, obviously someone has to replace you. So I feel like there's more flexibility than working in like an acute or long-term care situation. You do get lots of questions outside of work. You do field a lot of questions. You get texted pictures of rashes. There's all that, but I enjoy that side of my work too. So I do think it provides a great work-life balance. I'm with a family. I think it's great. And that kind of brings us to the end, unless there's any questions.
Very good, Teri-Lynn. Yeah, I think it shed more light on public health nursing for myself. Even I mean, you kind of know what people do, but you don't really know what people do at the same time because you know it's just kind of what you've seen and observed. I was going to comment a question about the life-work balance that you answered right at the very end. Like, just for people to know, Teri-Lynn is a former student of mine, married to another former student of mine, and they live down the street from myself right now. And I know with this, you know, the mom of 5, like, how important is that, like, to have this life work balance? Because I think sometimes young students don't necessarily, because they aren't looking after, you know, other children or anything like that, like a parent is. So how important is it?
It's huge. Yeah, I couldn't, yeah, at this point in my life, if I didn't have the flexibility that I have in my job, it would be really difficult. Just, I mean, your kids' activities often happen on the weekends or in the evening. And if only one parent is available to do that, that would, yeah. And yeah, I think it would be really easy to get yourself burnt out if you were trying to manage both of those things. So that is one thing I really appreciate about this job is the flexibility and the work-life balance that it provides for myself and my family.
That's good. And I just, again, like I said, I think a lot of young people going into a career, sometimes, you know, that isn't their biggest concern, but yet, you know, maybe in a few years down the road, it becomes more of a thing. Yeah. Just an observation. I really don't have many more questions. I think you answered everything really well. I mean, I observed you at an actual immunization clinic with a child that was, you said that situation where they're not necessarily looking forward to the needle. And
no,
this child was not looking forward to it, but I really admired how you just seemed so calm and patient and reassuring. I don't know if the kid ever got his needle that day, but it was just like your response to it. I was watching it from a distance, and
Yeah.
I go, oh man, I couldn't do
Yeah.
that. I
When
couldn't.
they go up, you need to go down.
So
Yeah.
I
Yeah, you just need often just need to be even for parents too, just that calming presence.
yeah,
So
yeah,
you really need to remember that.
yeah, because I mean, the more tense the kid gets, sometimes the parent
Yeah.
gets, but yeah, so somebody needs to be the calming influence, and I certainly, my observation of you was that you were that, and
Yeah. And
kudos.
I always tell parents, I consider this a success if the child is immunized at the end of this interaction. So the embarrassment part of it, like, don't worry about that part. It's good. We're good.
Yeah,
We're gonna
yeah,
get through
it
this.
puts it does in that mass immunization setting. It does
Yeah.
put the parent maybe more so than the kid in a difficult spot because they realize everybody's probably
Yeah.
looking over
Yeah. Yeah. No, for sure.
there because I
For sure.
was.
Yeah, you get into some interesting situations anyway. But yeah, like I say, it's a success if they end up immunized at the end of it.
Yeah, awesome, awesome. Well, thank you very much. Appreciate that. I think I will end it at that then. Okay.
Thank you very much for having me.